Hey everybody, so last video we talked about basic anatomy, that ball and socket joint. It is different than our low back and the SI joint. But now what I want to talk about is something different, right? The anatomy itself is how the structure should be. But then we have soft tissue, right? I talked about the muscles and the ligaments and the tendons. And so we have bumper guards on our hip. They're called bursas, and they're just like this balloon, all right? We actually have quite a few in the hip. All right, quite a few, but one of them is bigger than all the other ones and it causes problems. So think about this balloon. We can fill it up with air. Just a little bit of air there, okay? And so if I were to tie this off, I just want to let you guys know for the sake of ratios, this is bigger than it actually is in our body, all right? But this is now like a bumper guard on this hip, right? Because this is really rough and big. And so what we have are bursas that land on the side, so when we bump onto things, it just bounces right off. Like I could drop this guy on the floor and just bounce right back up in my lap, all right? So I use as an example for a bursa because bursitis is inflammation of the bursa in our hip, and it can actually cause like topical or superficial pain here. So keep watching. Again, we're gonna do a series on these, and I hope you're learning stuff.